everyone, and it's really a pleasure to be able to talk with you for a few minutes. I think Dr. Wu's talk really set up this topic well. What I'd like to do is talk about family communication in the context of Lynch syndrome, and really talking through a little bit on the content of those conversations, what recommendations are for why you have these conversations, who you should talk with, what and how. And then I'll share some of the research we have on challenges that can happen when you think about family communication in the context of Lynch syndrome. And then research that tells us how we can address some of these challenges and make those conversations more effective. And then at the end, I'll just share a little bit of additional resources for those of you who are interested in this topic. So first, what does the research tell us about why we want to have these conversations? I think this is something you've heard already from Dr. Wu's talk as well as from others. But there are a number of reasons why to talk about Lynch syndrome. The first is to provide information to your family members for their own health. So talking about potentially their cancer risks, the potential for genetic testing so that they learn more about their risks, as well as potential for risk reduction strategies that you may have learned about from your providers or genetic counselors. Research also tells us that people are interested in this information because they would like the information for life planning. Dr. Wu mentioned reproductive decisions, and that is certainly important for younger family members, for example. But there is also good research that family communication allows social support to be shared within the family. So for you to support others and for others to support you. And family communication can really help to build that type of support within a family. So one of the questions that we're often asked in family communication is, who should I talk to? So the recommendation is often to start with your close family. So parents, siblings, and your children. The recommendation is to talk to both men and women, although we have seen in the literature that people tend to talk more with women, but sharing this information with both men and women is important. And then as the information goes outward in the family to extended relatives, then you can talk with nieces, uncles, nephews, aunts, cousins, and grandkids going outward. Often this depends on genetic test results, and so what type of test there is and what side of the family. But the recommendation is to start with immediate family and move outward. And one of the great things that you have access to, and you just saw the email to get in touch with the clinic, is that one of the things genetic counselors can really do is help you think through who in your family would benefit from this type of communication. And who would benefit from potentially choosing to do genetic testing. So this is actually one of the questions that comes up a lot when we talk about family communication, and it's sort of, what should I talk about and where should I start? So the recommendations are that you can start with thinking about sharing your test results. So this is new information that I just got. Here's what I learned about the specific gene mutation that I carry. You may want to talk about information about your own cancer risks or what you've learned about potentially cancer risks for other family members. Information about risk reduction, so what people can do to reduce their risk, and you've heard a lot about that earlier in this session. But also sharing potentially a letter that you may have gotten from a genetic counselor or other resources that you have that describe these topics. That's often a good place to start, to share information and results that you have gotten yourself. And I think the second most common question that we sometimes get is, how do I have these conversations? How do I even start these conversations? So just in thinking about how should I talk to my family about Lynch syndrome, the question really I think you can think about is, how does your family usually share information about health more broadly? So does one-on-one conversations make sense for your family? Does your family talk about things in a group? In person, COVID aside, but in person or phone? Is your family a text or an email? Does your family usually share a lot of detail or not? And another thing to think about is what are the usual patterns of communication in your family? So in putting together this talk, I was thinking about having to share some health information of my own with my nieces. And the way that actually happened was I talked to my brother's wife first, and then she and I talked to the kids together. And so it was sort of the usual pattern of communication in my family, and it felt more comfortable to deliver information in that way. And again, you may want to think about sharing letters or other resources. So I just wanted to spend a minute or so talking about what the research tells us on some of the challenges that families with Lynch syndrome may face in talking about their test results or cancer risks more broadly. People sometimes tell us that they're not sure how to talk about genetic risks or talk about the uncertainty that there can be around risks for family members. They have found that family members or people sometimes feel that family members may not want the information or they don't want to cause family members worry. And the third most common challenge is just challenges with family relationships. So the degree of emotional closeness you have with someone, how your family discusses information or doesn't, and then potentially more challenging relationships within the family. So there are a number of suggested steps for how you may do these conversations more effectively. So getting started, thinking about who would benefit from the results, maybe starting with siblings or children or parents, thinking about, again, how your family communicates, and choosing a setting where you and your family member feel comfortable. But then starting with how much do people know already? The answer may be nothing, but then you can build off of that. And how much do people want to know? These conversations seem to go best when you actually ask people, how much of this do you want to know? Do you want to know the genetic result? If they want to know that information, the conversations often then share the genetic test results. As Dr. Wu talked about, it's important to respond to people's feelings and know there may be a range of reactions. And then talk together about follow through. So the potential may be that your relative might consider family testing themselves. I'm thinking about family communication as a process. So this isn't something where you would need to give all the information at once, and it does not have to go perfectly the first time. And in fact, what studies tell us is that it often doesn't go perfectly, but it goes well enough so that you can continue the conversation. Another recommendation is actually to plan out in advance what you'd like to say. Maybe write it down, maybe not, but just think through it. Use resources that you have, like genetic counseling letters, and I'll show you a couple of other resources. And then the importance as well of seeking support for yourself and making sure you feel comfortable with the information before you share it. And then finally, just to wrap up, knowing every family, but every person in every family is different. So some people might want all of the information, some might want very little, and that's okay. Trying to meet people's needs as best as you can. But also know that other family members will make their own decisions about genetic testing and about risk reduction. And again, just trying to meet people where they are with these conversations. So just to share a couple resources that I used in putting together these slides, but also have shared with others. So of course, the genetic counselors are a great source for how to have these conversations. There's also nice guidelines on talking to family about Lynch syndrome with some sample materials from the Centers for Disease Control and Prevention, as well as the Genetic Alliance. So I will stop there. Thank you all for joining us.